guys. So I am truly like 5 days out from my surgery, and I wanted to go over all of my post-op supplies and what they're being used for and everything, because I have a feeling when I get out of surgery I'm not going to be able to properly do this. So let's go over all of my post-op stuff. So here is my post-op supplies. So we'll go everything one by one. So the first thing I have here are a bunch of different, well, not different, they're the same, but they're basically just headbands. So this is for the brow lift because you're gonna, there's gonna be staples and incisions up here in the hairline. And so I don't snag or accidentally touch. I will utilize these to just kind of tie on my head. And the reason I got ones that are like this, where I can tie it, is because I am so prone to headaches. If anything is tight on my head, I instantly get a headache. So I wanted something that was adjustable. These are soft. And because of hygiene and making sure the area is clean, I got a pack. It has like 5 different ones so that I can rotate and cycle them out. I don't want to be putting the same one on my head over and over and over again. The next thing I have is just Tylenol. This is 650 mg. I'm sure that I'm going to get pain meds from my doctor. They actually are going to send me a prescription that I need to go pick up, but I am going to get actual pain meds and Tylenol from my doctor, but I have this on hand as is. This is bromelain. This is kind of like I guess it's like an enzyme that really helps with bruising, is said to help with bruising. So bromelain is like a staple, and I had this already from one of my other surgeries, so I already had bromelain. So this is hopefully going to help heal the bruising faster, because I do have to go back to work in about, like, I think I only have like 9 or 10 days, and then I'm straight back to work. I'm not going to be like in work physically, but I will be at work for Zoom, like Google meetings and Zoom calls. So yeah. This is like a generic Miralax, because you tend to get constipated, and that's no fun after surgery, especially because of the anesthesia. These are arnica tablets that also help with the bruising, stiffness, swelling, and pain. So these are internal arnica tablets that you can utilize to help decrease swelling and help the healing process. I also have arnica gel. This is again for bruising, swelling, injuries, muscle pain, stiffness. So if I'm gonna have like a lot of bruising under the eyes or anything like that because of the fat transfer or the rhino, then I can just put this under my eyes or anywhere that I'm experiencing major bruising to help kind of speed that process up. Of course, we need scar gel. So I have 2 different scar gels that I've had from my upper bleph, and I will be utilizing those. I think I might have just one tiny incision under the nose and maybe some light scarring up on top for the, what do you call it, the brow lift. So that will be my scar gel that I'll be using. Nasogel. My nose is going to be dry, crusty, rough. It's going to be very uncomfortable, so I have some nasogel. I already had this because in the wintertime I tend to have really bad allergies and I get crusty and stuffed up anyway, so this will just help keep the nasal area hydrated throughout the process. I also have this saline spray, sinus, allergy, and cold. So this is like a cleansing spray that you can just up the nostrils. I also have a wound wash from Nelly Med. Neomed, not Nelly Med. And this I will use to clean any incisions or things like that. So I'm going to have probably the incision under my nose. I could use this to clean that. I'll have the incisions, the staples up in my head. I can use this to clean that out, make sure it's sanitized. I'll have sores in my mouth. This is just saline, so you know what, I don't know if I can put this in my mouth, but I am planning on doing that anyway. Just a little spray here and there. Maybe not. Maybe I'll look that up. I'll have small incisions on my arms for the arm lipo. So this is just ways to quickly and easily make sure that everything is sanitized and I don't get any infections. I also have this mouth sore oral rinse. This is for the buccal fat removal. It's specifically for canker sores, cheek bites, braces, and denture irritation. So it's with hydrogen peroxide. So because I'm going to have those incisions in the mouth for the buccal fat, this is going to be like my oral care mouthwash for that. I also have this is an antiseptic cleaning spray, and it also helps with pain relief. So this I bought specifically for the brow lift incisions that I'm going to have up here, just in case they're painful in any way, and I want to make sure they're clean and reduce some pain. And this is just a very easy way, because like my hair is going to be in the way, you know, it'll be hard to like go in there with, like, I don't want like a Q-tip or a cotton pad or any kind of like residue rubbing off into the staples or anything. So this is a really good way to just spritz and make sure everything's clean. Vaseline is always a good idea, especially for the nostrils and the dryness. What else do I have? Oh, I have Biotine. This is for dry mouth. So because obviously I'm getting the rhino, my nose is going to be clogged up for a while. I'm going to be breathing out of my mouth, and that sucks. Nothing worse than having like a really dry cotton mouth, and it just starts to hurt. And also with the anesthesia, your mouth can get a little bit sore and dry. So this is like a moisturizing gel that you just put on your tongue, and it adds more hydration and moisture into your mouth. So this helps with dry mouth issues. So I got that. Also got these Ricola nasal care cool passage. This is like a, you know, it's just a kind of like a cough drop or a mouth drop to help kind of soothe that dryness in the mouth, as well as open up the nasal passage, because I am going to be so stuffy and that's so uncomfortable and sucks. I also have just some general that I've already had, like basic cotton rounds to kind of clean up my face a little bit with some water if I'm unable to shower. I have cotton swabs for all of the nasal cleaning that I'm going to have to do. I also have these, which are, let's see, these are like those, like a nose gauze pad if I'm like leaking a lot or I'm so stuffed up and like boogies are coming out of my nose. So you can just, you know, throw this on behind your ears and call it a day and not have to be like constantly, because the constant like wiping or, you know, pulling on the nose, it gets really uncomfortable. So I wanted to have these handy just in case there's a lot of dripping or fluids coming out of my nose while I'm healing. And then I have these are rinse-free bath sponges. I'm gonna be able to take a bath, it's fine, but having something, like, I'm just so concerned over the sanitariness of everything. I like to have something that's disposable. I don't want to be putting, I don't know, like my bath sponge on like my incisions or like my lipo incisions on my arms or anything like that. So I like to have something that is very much just disposable. And again, if I for some reason can't get into the bath, this is no rinse, so I could just, you know, in the sink, like do a horse bath and call it a day. Okay, and then the last thing I have to show you is my arm compression garments. So these are from Ketomed, and I just, right now, this is the brand that I like for post-operative garments. That might change, but I feel like they are the most comfortable and the most well-made. So basically, it's just a little sling for my arms. So I just put my arms in for compression to help with the swelling. And I have two of them. So while one is in the wash, I always have another one to wear, and so that will help the swelling and overall shape of the arms after my post-op. So that is all of my post-op supplies. That's a lot of supplies, isn't it? I'll let you know what ends up being the most helpful and the most valuable. Oh, I also got a wedge pillow so that I could lay and rest like elevated, because you're not supposed to lay down all the way flat and you're not supposed to like lay on your side or anything like that. So I got a wedge pillow that's in my room, where I can be kind of elevated and stick to a lying position that is conducive for my surgery, so I don't roll over on my cheek and ruin my fat transfer. So yeah, that is everything, guys. I'm freaking nervous. I honestly was freaking out like a week ago, and I think it was because I was on my period, and I'm getting really emotional when I'm on my period for some reason. So I was so terrified. Like, I was having nightmares of the surgery while I was on my period for it was like 2 days where I had like really, really high anxiety, where I was like, oh my God, what am I doing? Like, this is crazy. And then I realized it was just because I was on my period, because as soon as my period like ended or was like towards the end, I was like, oh, actually no, like I do still really want to do this. And it's now I feel like I'm like 5 days out from getting the surgery, and I feel really calm and I feel really good about my decision, and I'm not like scared or terrified anymore. I don't know, it's just weird. It's weird. I don't know. I'm looking forward to it, like, honestly. I just want to get it over with already, is mostly how I feel. Is like, I'm just like, let's go. Like, I wish I could go tomorrow and just like be done with it and start my healing process already. But alas, I have to wait for my surgery date. I also paid everything. I don't know if I want to share yet how much I paid for all of this, because it wasn't cheap. And I don't know. It wasn't cheap, okay? So let's just leave it at that. But I don't know if I want my financial business all out like that. Maybe if you GM me, I'll tell you. Maybe if you DM me. Also, everybody's just so different. So it's like, what it costs for me is going to be different than what it would cost for you. Okay. We'll be in touch. I'll let you know. Bye.